Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Mr. Colin Lake. He's joining us here as Vice President of Digital Business Transformation for Neurology at UCB. He's going to talk about the company's approach to digital solutions and how they complement UCB's medicines for people living with epilepsy. He's also going to spend a bit of time talking about a brand new collaboration with NextSense. Now, NextSense is a data platform and research on detecting seizures with biosensing earbuds. These earbuds can be worn comfortably at night and as needed throughout the day. Welcome to Health Professional Radio, Colin Lake.
And thank you very much, Neil, for having me here.
Vice President of Digital Business Transformation for Neurology at UCB. That is a mouthful. Give us a bit of your professional background and talk about your role.
Thank you, Neil. Yeah, it is a bit of a mouthful, but it's a very important and critical role that we see here at UCB. I've been in the pharma industry now for just a little over 15 years and very much been involved in this digital care, digital transformation all that time, and really seen it springboard from just various ideas that we were having all those years ago to really being front and center and very important as it is now. Mm-hmm. And here at UCB, the role is very much around how we can use digital to improve patient lives and improve the outcomes of patients with these debilitating diseases.
Well, I guess improving lives and having very positive outcomes would be why digital within healthcare is so important. Are there any other aspects of the importance of digital within healthcare?
Yeah, a lot of it just comes down to data. Everything is data-driven these days, and what that data enables us to do is really personalize and target what we would need to do with these patients and when we need to do it. So obviously the first challenge is capturing that data, and then from that is then getting those insights from the data. Mm-hmm. We're very well aware now that just drug treatment alone is not enough to maximize those outcomes of patients and to provide that quality of life of patients, particularly those with chronic diseases. So how can we go beyond that? How can we look at that holistic care? And I think utilizing that data to identify points which we can help those patients is critical in digital at this point in time.
Now, obviously, UCB isn't tackling these challenges alone. Can you talk about some of the collaborations that UCB is exploring concerning, the digital perspective in healthcare?
Yes, and I think this is a very good point that we can't do this alone. It has to be partnerships to move this forward. Partnerships with technology companies, partnership with patient organizations, partnerships with clinics. What we talk about here is some of these partnerships we've done with these technology companies. Critical ones recently have been NextSense, as you mentioned earlier, who've recently come out of stealth mode, Biteflies, and a company called Neurology. With NextSense, it's a platform that starts with some continuous EEG data collected at the point of experience with some biosensing earbuds that can be worn very comfortably at night and as needed during the day. That form factor is very critical because stigma is always a big problem with chronic diseases. You don't want to be reminded constantly that you have some. We're looking at how, with NextSense, how we can better calibrate and manage these care plans for people living with epilepsy by this continuous data collection. We envisage that combining the data with environmental and behavioral patterns collected from, also combined with smart devices, we can provide this timely analysis to help doctors identify triggers, diagnose conditions, and then tailor their treatment and medication. Biteflies is very interesting. It's again a wearable digital biomarker. And what we love about this one is the multimodal approach for this one. It records brain, heart, and muscle activity through a combination of EEG, ECG, and EMG, as well as using accelerometers for movement. It has very similar capabilities to traditional video EEG. But again, because of the form factor, you can wear this at home, so you can have that constant monitoring to provide that highest quality of care. And finally, if I may talk very briefly about Neurava, what we love about Neurava is this exciting use in what's known as SUDEP, which is sudden unexpected death in epilepsy, and being able to monitor people as they sleep and provide a warning to help provide an intervention if that is monitored.
I heard you mention stigma earlier. Is that stigma the main reason why there's a lack of reporting seizures to clinicians? Or are there other aspects that people living with epilepsy are dealing with that prevent them from reporting in a timely manner or at all?
Yeah, there's a number of factors that happen in it to prevent the accurate recording. Traditionally, recording of seizures has been done with a seizure diary, which again has often been a paper-based approach, which just isn't practical and timely. Now, that has been significantly improved in recent years with the onset of digital diaries. But again, it's having to take that time to go, oh, yes, something happened, I better record it, better report it. And what we found is that a number of times people aren't recording it. I mean, I think it's a significant factor that it's like almost half of seizures aren't recorded, either because patients don't feel, well, maybe it wasn't worthwhile recording it, it wasn't really that bad, or maybe it's even they didn't even know that they were having a form of seizure. Mm-hmm. So I think that combination of the stigma, as you mentioned, and then just that, well, I don't want to overburden somebody by recording something which it wasn't really anything significant, or perhaps just not even knowing has led to that significant underreporting of seizures.
The American Epilepsy Society had its 75th annual meeting this past December. Can you talk briefly about some of the data that was presented at that meeting?
Yeah. So leading up to ANS, we first announced our collaboration on working with NextSense to improve these patient lives. And we thought that was a great moment to connect with the community at large and meet with stakeholders and potential partners to talk about what we see in these digital care solutions. And then, as you mentioned, NextSense presented some of their clinical data at that. It was data that was theirs. It wasn't something we'd done yet in combination with UCB, but it was certainly data that was showing some very, very early promise in what this product can provide. Mm-hmm. So we're excited to move forward with that and hopefully do some joint presentations moving forward.
Well, it sounds exciting, very promising for that community. Can you give us a website where we can learn more?
Yes, certainly. I think the best place to start is to go to ucb-usa.com. And from there, you can see a lot of what we're doing and pick up more information about this. And if you want to, get in touch with us.
Great. Colin, it's been a pleasure this morning. I thank you so much for joining us and taking the time. Hopefully we'll get an opportunity to speak again. Thank you.
Thank you very much indeed.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Colin Lake. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.